Okay, so we're about to do med checks.
Yes.
So these are the lovely students.
Hi.
Madame Dana,
Dana.
Madame Angela.
Angie and Brenda.
So they're going to be
Hi.
showing you how to do a med check. So get ready, get your pens and papers out. Alrighty, let's do this, ladies. Okay. So they already cleaned the cart. They already made sure that everything was tidy, so that they did with their wipes.
We moved everything. We cleaned everything.
Yep.
Our CMR is disinfected already. We cleaned the inside. We cleaned the tabs. We cleaned the outside. We have our yellow paper. We got a report from the nurse already. We told them we're giving meds already until 10 o'clock. We're going to put our paper inside. And now we begin. So here inside the Cardex, Miss Angie. Inside the CMAR, we have our Cardex. This gives us a snapshot of the patient, and allergies, their diagnosis, past medical history, which is pertinent to your medications, level of care, diet. Sometimes there are other things here. Then we will have like a TNP. Sometimes it's filled out, sometimes it's not. Our fall scale. Here we have our treatment sheet. So here we're in the evening. We want to do vital signs regularly, activity as tolerated, check the ID bracelet Q shift, weight bearing as tolerated. So once we do it at our shift, we will initial it, and then I will sign on the bottom. Here we have our sliding scale for insulin. So we will talk about this after. This is our treatment, our stat sheet. So when we receive stat orders, we will put it in here. This was a NS bolus, 500 cc's times 1, that was done by the nurse. And here we have our medications. So if we want to start by doing our first check, we need our patient identifiers, which we will find in our bin. We will get our bin. So this is room 14. I'm going to go into thing 14. We will get our patient identifier. So here on our package, we have the patient's name, the MRN, and their room number. So we want to start by comparing first if we have the right patient. So we have Myrna Smith, MRN is 4302. Here we have 4302. And they're in 14 East, that's the floor we're on, room 14. So 14 East, room 14. The patient has been identified. We can put this away, back to the side. And the things we want to look for are here. We start with the notes. If there are no notes, we give the pills whole. Sometimes there will be notes to crush the meds, put them in applesauce. In this case, we have no notes, so we will say, there are no notes, we will give the pills whole. Next, we look right below it, allergies or intolerances. This one has penicillin. Well, let's pretend there. So her allergy was penicillin. So that's where you would find it. So after we do notes, we do allergies, we go straight below it. So we're kind of going in order. Notes, allergies, straight below it, we have today's date. So today we are the 16th of October, 2025. Just to confirm that. And then we want to check the page numbers. Before we start on any medications, we want to do the page numbers. So here, page 1 of 7, we want to make sure that it has the patient's name on it. Myrna Smith. Change the page. 2 of 7, Myrna Smith. 3 of 7, Myrna Smith. 4 of 7, Myrna Smith. 5 of 7, Myrna Smith. 6 of 7, Myrna Smith. 7 of 7, Myrna Smith. And it's been signed by a nurse. This means that the nurse has verified all the pages are there and she signed it. Then we can flip back to the beginning and start our medication check. So we're going to start from the beginning. Usually if it's the first time you're doing medications, you want to get something to cover. It's a lot of information at once, so you want to get something to cover so that we're looking only at the times. So right now we are 19:25. So we're going to prepare the PM meds. We're going to prepare 7, 8, 9, 10 o'clock meds. So here we have not due. And we will say it. It's not due, not due, not due, not due. Next page. You want to block it again? Here it's 2100. This is due. So we're going to pretend like there's no signature here. So we will say due at 2100, due at 9 o'clock. Then we're going to say to ourselves, okay, on hand, we have atorvastatin, 20 milligram tablets. The doctor has ordered 20 milligrams. This makes it a 1-to-1 ratio, so we're going to give 1 tablet. Well, then we would go get our medication in our drawer. So we're in a Smith, so we would look inside. Oh, thank you. Oh, thank you. We would look inside, and then I'm gonna look for atorvastatin. This is melatonin, atorvastatin. So then I'm going to take the medication and compare it to what I just said. So we have here, and you want to take your pen and actually make the check marks, guys. Atorvastatin, 20 milligrams. We have 20 milligrams, same as the doctor's order. The tablet is right here. Make that circle. Circle the tablet, and then you check what? The expiration date, 2026. It's not expired. That was our first check. You check the name, you check the dose, you make sure that the pill is there and intact, and you check the expiration date. Boom, 1 big check. That's our first check. Put it to the side somewhere. After our first check, we're gonna do our first dot right before the time. That tells us that it's not that we've done our first check. So this is, by the way, this is me doing my first check. So Miss Mary has not been here, and so I won't tell her about the drug yet. This is just me doing my first check. So I've said to myself, okay, I've prepared my first medication. Next, I have here again, due at 2100, due at 9 o'clock. On hand, I have Bizacadil 5 milligram tablets. The doctor's order is 10 milligrams. So on a separate sheet of paper, I'm going to do my calculations. So we're going to do our D over H times Q. Is it times Q? I think that's what it is. Anyways, so the doctor's order is 10 milligrams. The tablet we have on hand is 5 milligrams times tablet. And so 10 divided by 5 is 2 tablets. You have to do the math because she's going to ask for it. Leave this to the side for when she asks for it. So, as we've said, here we have 2 tablets. So I'm going to go into the drawer and find our Bizacadil.
What's the name of the med?
Oh, and you want to also, oh yeah, times V. It's times V equals Q. Thank you. And then beside it, we will write what the med is. So, Bizacadil. So what it is? So we'll put that to the side, and let's go get it. So here we have the Bizacadil, 2 tablets. So here we have Bizacadil twice. Bizacadil, 5 milligrams, and 5 milligrams equals 10 milligrams, which is what the doctor has ordered. That's how you want to say it. 5 milligrams and 5 milligrams equals 10 milligrams, what the doctor has ordered. Then what else are we going to look? The tablets are here. Oops. The tablets are there. Right? The expiration date is 2025 December. We're still okay. And that's our first check. So 1 big check mark to say that we've checked it once. Put it to the side with our other medication. First dot before the time. And we move on. Not due. Not due. Not due. Next page. Not due. This was due, but if we look, this has been discontinued today at 2:40, so it's not due. This one here, due at 9 o'clock. Pretend like it's not signed. So here we have hydromorphone extended release capsules, 6 milligrams. That's what we have on hand. The doctor's order is 6 milligrams, which is a 1-to-1 ratio. So we're gonna give 1 capsule. Oh, nice. So hydromorphone is dilaudid. This is a narcotic. So this will not be kept in the cart. It will be kept in the narcotics case. And in that case, you have to go get a nurse, an RN, or an RN or an LPN, and they have to let you in, and they have to prepare the medication with you. So I have already gone to my nurse. I brought my CMAR. I showed them what I needed. They helped me to prepare it, and so here I have it. It's my hydromorphone, okay? So this was already prepared with a nurse. The dose has been confirmed and signed in the narcotics book. So here I have it. I'm going to put my dot. Okay? Not due. Not due. Due at 2100. Due at 9 o'clock. On hand, we have melatonin, 3 milligram tablets. The doctor has ordered 3 milligrams, so it's a 1-to-1 ratio. We are giving 1 tablet. Here, if we go in our medications, we're gonna look from. Actually, melatonin is a stock med. So I won't find it in here. Visacodil is also a stock med, so I will find it. Our stock meds are, look, if you see it says floor stock. If we open it, there's a bunch of medications here that are stock meds. It's Tylenol, Senosides, melatonin. So I need 3 tablets. I need 3 milligrams, which is 1 tablet. So I'm going to get 1 tablet. Do my check. Melatonin, 3 milligrams. I'm doing my checks right. Make sure you're actually checking it. Here's the tablet. And here's the expiration date, 2026. Our check is done. 1 big check to say we've checked it once. What do? We put our dot before the time. Moving on. This is due, but it has been crossed off. If we take a closer look, it says that it has been discontinued. It tells us the date was discontinued today at 2:40. So none of our business. We keep going. Not due. Not due. Again, this one has been crossed off. If we take a look, it's been discontinued. We don't look at it. Keep going. The following one, due at 2100, due at 9 o'clock. If we go, on hand, we have Senosides tablet, 8.6 milligrams. On hand, that's on hand. The doctor's order is 17.2 milligrams. So we're gonna get our paper back. We're gonna do our math. The doctor's order is 17.2 milligrams. The dose on hand we have is 8.6 milligrams times tablet. Gives us, and we can take out your calculator to do this.
Divided by
8.6. 2 tablets. So we're going to get 2 tabs of Senosides. Okay. Put our paper back, and we get our Senosides. This is also a stock med. You'll find it in the stock store. Here, Senosides. So before anything, you're gonna make sure that you have the right medication. So here, can you see it in the lighting? Senocide, 8.6 milligrams. That's what we have, 8.6 milligrams. And we also want to make sure that it's not expired. So we look at the expiration date, October 2026. We're okay. So we need 2 tablets as our math has deemed it, but we're not going to do it right now. We're going to wait for Miss Mary to come and do it on our second check. So we'll put it on the side with our other check medications, but we will put our dot anyways because we got our medication out. Next we can go, not due. This one is an added medication at the bottom. It's due at 2200. We have Humalog according to the sliding scale QID 4 times a day. At this point, if you have an insulin, we have to go to the sliding scale. So flip backwards. find your sliding scale. It's always with the yellow paper. Before you do anything, you make sure that you got the right person. Myrna Smith, MRN 4302, and she's in room 1414. So we have the right patient. We're gonna come here on this side and we're gonna look at our CBGM. So I took her CBGM at 2100 and the result I got was 12.0. So 12.0 millimole. That's our result. We're gonna skip over now to the sliding scale. If our result is 12, that falls within the category 10.1 to 12. So we're gonna take our finger, 10.1 to 12, we're gonna slide it all the way down and we're going to bedtime, right? Because that's what we're giving, bedtime. We're gonna pretend like the doctor has already ticked off low dose. So 12.1, 12, we're gonna go here. It says +1, add units of insulin to the baseline dose before meals and at bedtime as noted. So here when it says +1, it means add 1 unit of what, you ask? Then you slide up. Humalog. They put it here, Humalog. So 1 extra unit of Humalog to the baseline dose. Let's go up further. This would be where you would find the baseline. It says here, baseline. It's 0. So that means we're giving just 1 unit because there's no baseline. Do you understand? So if we go 12, again, 12, slide to bedtime, +1 unit of Humalog. It will always be indicated to the baseline of 0. So it's +1, 1 unit. At that point, I'm going to get out my Humalog, find my Humalog in here. You'll find it in the drawer. There's all different types. There's Lantus. You'll have Humulin R2, MPH. But here we have Humalog. So we're going to take it out. We're going to compare it to the CMAR. We have Humalog. Usually, if it's not written on the bottom, it will also give the concentration of the Humalog. So you want to also compare that to what's written. In this case, it's not written, but let's pretend it is. 100 units per milliliter. So then you would compare it. Oh, it says 100 units per milliliter. You want to check also when it has been opened, because how long is insulin good for? 28 days. So 2025, 10, 6. 06, I believe. So it's with the 16th, it's been 10 days. It has not expired. But you also want to check the expiration date on the vial just to make sure that that's not expired. So 2027, it's not expired. So everything is okay. We're gonna take this, we're gonna put it to the side. Before we do our dot, let's make our label, because now we understand we know how many units we want to give. So the patient is for Myrna Smith in room 14. The insulin is Humalog. And we said, according to the sliding scale, right, we needed 1 unit at supper time. So we're going to put 1 unit. So we're going to give it at 2200. Today's date. And it was prepared by me. So we have this at least to show Miss Mary that we've done the calculation. We've looked at the sliding scale. We know what we're doing when we go and see her. Now that I have my label made, we're going to put the dot. Okay? So those are all the scheduled meds. Now we're at the PRN medications. All you have to do in this case is tell Miss Mary the generic name, the trade name, and the classification. So in this case, dimenhydrinate is Gravol, also known as Gravol, and it's an antiemetic. Glycerin is a osmotic laxative. Hydromorphone is Dilaudid. It's a opioid analgesic. Same thing, opioid analgesic, Dilaudid. Lactulose is also a osmotic laxative. And finally, we have a mineral oil enema, and this is a lubricant laxative. That's all. That's all you have to say. We've done all 7 pages. That's our first check. We've completed our first check on our own without Miss Mary. Now, before getting her, we want to go back to the beginning, get our medication cards ready. So here I have my stack of medication, my cards, right? I'm just gonna put them in order before so that everything flows nicely when we go see Miss Mary. So I need to prepare atorvastatin. So I'm gonna get my atorvastatin. Next is my Bisvacadil. Here, Bisvacadil. Then we have hydromorphone, melatonin, senicides, and Humalog. Okay. Everything is on the side. We want to keep things as clean as possible for when Miss Mary comes. I'll go here like this. Before we go get Miss Mary, we have to then think, okay, are our medications checked the first time? Is our math done? Do we have our cards already in order? We want things to flow smoothly when we go see her. We don't want to be fumbling for things. We don't want to be like stuttering. We just want it to go from A to Z. So my cards are here. My medications are here. I feel ready to go get Miss Mary now for my second check. Or in this case, Miss Mary 2.
Miss Mary's here.
Miss Mary 2.0.
Yes.